We received an email that led to a food intervention for a certain Mr. Claus, and it seems we now have a follow-up email. Dear doctors, thank you for intervening last year with my husband, Nick. He's eating healthier, but I do worry when he drinks coffee to stay awake for the longest night of the year. Is all that coffee bad for him? Sincerely, Mrs. C. Well, Mrs. Claus, if you're drinking so much coffee that you're irritable, you're restless, you have insomnia, well, no, coffee's not good for you in that case. But as long as you're drinking in moderation, coffee actually has some very good health benefits, Mrs. Claus. So, you know, Santa may have his cup of coffee to get him out on the sleigh. One thing actually coffee can do is it can actually decrease your risk of abnormal heart rhythms. And maybe even it's associated with a decreased risk of heart disease and type 2 diabetes. Now, these are associations, but the thought is that coffee is actually really high in antioxidants. What else? Coffee may be helping Mr. C's brain because it's been shown to be associated with a decreased risk of Parkinson's disease as well as other dementias. In fact, regular coffee drinkers 65% less likely to develop dementia according to some studies. Now, what's it doing to Santa's belly? Some good things. In fact, there is again an association between coffee and a lower risk of gallstones, possibly even colorectal cancer. Having said that, loaded with caffeine, people with irritable bowel syndrome, we all know too much coffee can cause some GI upset. So overall, Mrs. Claus, coffee can be good as long as Santa isn't over drinking it. And you know what? This information, it doesn't just apply to Santa. It's true for everyone.